is Faithies, and this is my dressing change video. I'm a doctor in the patient store, perform hand hygiene, patient privacy. Hello, my name is Faith. I'm going to be changing your dressing today on your wound. I'm a nursing student from SEMO, and I'm just going to be taking care of you. Can you just tell me your name and date of birth, please, while I check it on your wristband? Just make sure it's accurate. Since it is, I'm going to raise the bed to a comfortable working height. And then I'm going to put this side rail down so that it's easier access for me for the wound. And I'm just going to uncover the part that I need to uncover, making sure that I maintain patient warmth and patient privacy. I've already done hand hygiene, so I'm just going to put on my gloves. Now I'm just going to make sure that I have my dressing tray kit and that it's not expired or been opened. This one has been opened just because it is for clinical purposes. So I'm just going to take that out, discard of that, open it away from me first, making sure that I'm staying in the outer 1 inch and that I can touch the shiny side because that part's going down. Then I'm just going to adjust it. Alright, making sure that I don't cross the middle. Alright. If I had a bigger wound, I would use this drape to protect the patient and the bed from any discharge, but I don't need it, so I'm going to discard that as well. I'm going to take out my gloves, put them to the side, and then I'm going to take out the trash bag. I'm going to put this in a convenient spot so that it's easy access when I remove the old dressing so that I can put it directly in here without contaminating the rest of the patient or the bed. So I'm just going to open this up, make sure I create a little lip so that when I'm done I can grab it easier, and I'm just going to put it between the patient's legs. After I've done that, I'm going to remove the old dressing. I'm going to carefully remove the tape from the patient, or from the patient, and open it away from the patient so that the odor does not make them nauseous. I'm going to check for odor consistency and color and make sure that I document it, and then I can discard. And then I'm ready to be sterile, so I'm going to discard my old these gloves. And I'm going to put there and there. Now I'm going to open my sterile gloves. Just going to move that away a little bit. Okay. I always want to make sure that I don't turn my back on my sterile field. All right. Okay. All right. Now I'm going to grab the cuff and put my hand underneath. Making sure that I'm only touching the cuff, and then I'm going to put my 2 fingers under. I can hold the outer 1 inch just for security, and then I'll put my hand in. Okay, and I'll pull that down, and then I will readjust because I am now sterile to sterile. All right, so now that I'm good, I'm going to now take my tray and dump it into the middle, because that's my sterile field, and I can discard of that. And then I'm just going to kind of organize my supplies. I don't need to use these things, and I will be using these in place of the betadine swabs because we can't use betadine on the actual mannequin, so that's what I'm going to be using. And then I'm going to also be using the gauze and the tape, and I'm just going to remove that to the side. And there's that. So I'm going to be starting with cleaning. I'm going to take a swab, and I'm going to go down the middle. Then I'm going to discard, grab a new one, and then I'm going to go down the side. Discard, get a new one, then I'm going to go down this side. Then I'm going to go discard and get a new one, and then I'm going to go down the side again. Discard, get a new one, grab one. Discard, and then I'm going to clean the incision site, that hasn't been sutured, so I'm going to get a new one, and then I'm going to go down the center, away from the clean wound, throw it away, come on the side, throw it away, grab a new one, come on the side, throw it away, grab a new one, clean this side again, throw it away, grab a new one, and clean the last remaining side, and then throw it away completely. Now I'm going to get my gauze. And I'm going to put it first on the main sutured site, making sure that I don't cross fields. And then I'm going to put one on the smaller incision site, and I'm going to place it without touching the patient, and I'm going to make sure that the two gauze don't touch. Now I'm ready for the main dressing to sum it all up. Make sure I put that down, blue line up, grab my tape, and I'm going to hold it gently, and I'm going to tape it in a window pane pattern. And then I'm going to put my initial, the date and the time that I changed this wound dressing, and then I'm going to now discard my gloves. Discard, and then I am going to grab underneath, since I made this lip. Discard an appropriate biohazard bin, so I've discarded that. I'm going to wrap this up and also discard. I'm going to perform hand hygiene. I'm going to make sure that the patient is covered up again, that the handrail is up and the bed is in the lowest locked position. I'm going to make sure that the collar is in reach and make sure that they are good and comfortable. My name is Faith East, and this is my dressing change video.